AIDS, others, they've come with the solutions and just have done incredible jobs. And I've asked them to contact London immediately. They have offices in London, the major companies, but more than major, more than size, they're genius. And I had a talk with 4 of them today, and they speak a language that most people don't even understand. But I understand something, that they've really advanced therapeutics and therapeutically, and they have arrived in London already.
I don't
The
even think
London
the
office
company
has
understands English that much.
whatever they need, and we'll see if we can be of help. We've contacted all of Boris's doctors, and we'll see what is going to take place, but they are ready to go. But when you get brought into intensive care, that gets very, very serious with this particular disease. So the 2 companies are there, and with what they are talking about, and it's rather complex and has had really incredible results.
Does anybody have any clue what he's talking about?
We're working with the FDA and everybody else, but we are working with London with respect to Boris Johnson. Across the country, we're attacking the enemy on all fronts, including medical, scientific, social, logistical, and economic. We're pressing into action the full power of American government and American enterprise.
Just not for the
And
states,
our
because they
military
have
has
to
been
handle
incredible.
themselves.
We've just sent 3,000 public health personnel. They're now deployed in the New York area, and they'll be over at the Javits Center, over at the Great Ship. And as you probably have heard, and I was informed that Governor Cuomo has already told you and announced, he called me up a little while ago and he asked whether or not it would be possible to use the ship with respect to fighting the virus. And we hadn't had that in mind at all, but we're going to let him do it, and we're also going to let New Jersey, Governor Murphy,
Send the ship up
spoke
there
with him
to
a
give
little
people
while
health
ago,
care.
and
Why
New
would you
Jersey's
not want to
going
use it for
it
the
also
virus?
because New Jersey is a hot spot. So Governor Murphy and Governor Cuomo are going to be using the ship, New York, New Jersey, and it's a big ship. And it's now COVID.
It's big ship, the huge ship, everything. I have to say that everything's big, huge, fantastic, wonderful. These press conferences could be half the time, could take half the time if it didn't give his commentary about things being big, being beautiful, being large, being fantastic, or whatever other descriptive words he wants to use to embellish and make it bigger than what it really is, because it is bigger and huge, big league. Now we wait for the signal to catch up with me, because apparently my Wi-Fi is not so good. It's not so good. I've had better Wi-Fi.
That will be very helpful to both states. The Javits Center, which is 2,900 beds, just built by our military, also is going to be manned now by the military, and they should be in place tomorrow. And they'll start sending quite a few people over to the Javits Center. It's convenient. It's right in the middle of everything. So that'll be something great, and
It'd be great.
we appreciated.
Everything's great,
nice,
except that people are dying.
nice statements, and likewise, Governor Murphy. We have worked very well with both of them, and with, frankly, all of the governors. Vice President Pence had a call this morning with them that lasted for close to 2 hours, and I understand there wasn't a negative person on the call. 50 governors, or just about.
There wasn't a
50
negative
governors.
person, because they all realize that they have to
from what I
kiss your ass in order to get help.
And they were very positive about everything their federal government has been doing for them, and you'll hear what that is, and it's rather amazing, actually. Nationwide, the Army Corps of
It's all
Engineers
because
is
of
building
me.
22
I'm
field
wonderful.
hospitals. These are big hospitals, and alternate care sites in 18 states. So you have a combination of 22 field hospitals. In addition to that, we're building alternate care sites, which is
Stay hydrated.
a little bit of a smaller version of the hospital. And We have a lot
Lots
of
of
them, and
water.
they're going
I
up in
drink the
18
best
different
water.
states. In
Better than
total,
any
we have
water
deployed
everybody else ever had. It's tremendous.
8,450
My cup of water,
hospital
it's
beds
tremendous. It's a big
from
cup.
federal stockpiles. And if you think
Trump would
this is done
explain
over a
the
period
fact
of
that he took a sip.
really a period of weeks, it's incredible actually. More than 8,000 ventilators have been sent from the national stockpile to our cities and states, backed by the Defense
How many are left
Production
that you're
Act,
holding back on?
which we've used very strongly, very powerfully. So powerfully that we don't have to use it too much, frankly, and it's nice
So
when we don't
powerfully.
have to. We're getting
So hugely,
more than we ever
bigly.
bargained for. American industry is stepping up. Manufacturers are really going to town, and we have thousands of ventilators being built as we speak, and we have hundreds that are being sent to different locations, and we're ready to roll with almost 10,000 that we have in the federal stockpile.
10,000. They're big. They're huge.
When I say ready to roll, too, I mean exactly what that states. We are wherever that.
I think we
monster
understand what you
goes,
mean
we're
when
able
when you say ready to
move with
roll.
it. Great
That's
flexibility. We
common
have
knowledge in the
tremendous flexibility.
vernacular.
And we have people waiting,
People.
and they're ready, willing, and able, but waiting to bring them wherever it may be, if they need it. If they need
They're
it.
needed. They're already
It's
needed.
possible that they won't be needed, that we're fully stocked because
They're needed.
numbers are coming in where, because of what the American people are doing, we're having fewer hospital visits. I think that could be the case in New York. It
I'm
could be the
impressed
case
he
in a few
knew.
other states.
Say fewer than
And
less.
fewer beds, fewer hospital visits mean fewer ventilators. So we'll see.
Someone
whether
drove
or
fewer
not
into his head?
Original
Or is
projections
he
were
just
right.
thinking purer?
But anyway, I had a very good talk with both governors, and I think they're very happy, extremely happy about the what we're doing.
Extremely
for them,
happy.
and especially
Immensely,
going
hugely,
long COVID.
bigly happy.
So that'll take place almost immediately. FEMA and HHS have directly distributed 11.7 million N95 respirators. Think of that. Get the number. 11.7 million N95 respirators. 11.7 million. 26.5 million surgical masks. 5.3 million face shields. 4.4 million surgical gowns.
3 French
And
hens, 2 turtle
22.6
doves.
million gloves. 22.6 million gloves. We have also arranged for vast quantities of additional
2
materials
gloves,
to
mostly,
be
per person.
allocated through donations
How
and
many
existing
staff,
supply
how many
chains.
procedures a
We've
day
also
that have to
given
change out? That's probably not a lot of
tremendous medical
gloves.
material and
You might
supplies
think it's a lot of gloves, but it's
throughout the
probably
50
not a lot. They
states
probably go
and
through that
territories.
very quickly.
And through Project Airbridge, we have succeeded in bringing plane loads of vital supplies into the United States from overseas. We had an additional 3. These are massive planes, by the way. The big planes are very big, very powerful, and they're loaded to the gills with
They're big
supplies.
planes. They're huge.
And rather than bringing them
Huge
into our
planes.
stockpile, as we've discussed, we bring them to all the different locations where they're needed, so we can save a big step and a timely step. Because of my actions under the DPA, I can also announce today that we have reached an agreement, very amicable agreement, with 3M for the delivery of an additional 55.5 million high-quality face masks each month, so that we're going to be getting, over the next couple of months, 166.5 million masks for our frontline healthcare workers. So the 3M saga ends very happily. We're very proud to be dealing now with 3M and its CEO, Mike Roman. I just spoke with him and I thanked him for getting it done. And Mike was very happy to get it done. Great company. So we're getting 166.5 million masks, and mostly that's going to be for our frontline healthcare workers. Okay, that's 3M. Thank you, 3M. I also want to thank Apple, one of the many great American companies that's taken into, that's really leapt into action. Today, Apple announced that it is now producing plastic face shields for healthcare workers at the rate of 1 million per week. 1 million, and these are the shields that you see on television.
We all know what the face shields are.
And they're at the highest level of quality. and safety.
They're the best quality, the biggest
we're
quality
grateful
ever.
as
No one's
well
ever had
to
better quality
Salesforce,
face shields.
which has donated 48 million pieces of personal protective equipment, including masks, gowns, suits, and face shields.
Sugarcoats so much
So
things.
thank you very much to Salesforce.
Give us all diabetes.
I urge all of our nation's governors to ensure that the massive deliveries that we've made to your states over the past few weeks are distributed as quickly as possible. So again, we're working very well with the governors. Now, they may see you and say, oh, we're not happy, but they're very happy on the phone. And Mike Pence is a straight shooter, and he had a great phone conversation to them with all of the governors, teleconference. And they're very happy, every one of them. Were there any negatives?
No, sir.
See? I told you. Mike is the greatest. Mike, and you have done a great job, Mike, and I appreciate it. The whole country appreciates it. Anthony appreciates it, right? Don't you see? Everybody appreciates Mike, special man. So
I have it.
a lot of the
That's a New Orleans
things that
joke.
we've done, again, are going directly to the states. The states seem to be very happy. If they're not, they can call me directly. They can call Mike directly, and we'll make them happy. But tremendous progress has been made in a very short
They
period.
can't refuse.
And I think very importantly, the progress has been made before the surge comes, because the next week and a half is going to be a big surge, the professionals tell us, and I think we're in good shape for it, Anthony. So it's good timing, really good timing. We
Can
can
you ever
have
really be in good
the
shape
stuff
for
there.
the
It's already
surge?
there for the most part.
I mean,
but
you're
we're
hoarding
bringing a lot
everything
of
especially when you're
different
hoarding things from the
resources
states, and
to the
apparently
various locations,
what they've
especially
done
where the
is,
surge is looking like it's going to
like
take place.
they want the states to prepare
Resources
for
from the
themselves. When the
national
states had the
stockpile
items,
need
they
to
took them
reach
from the states.
Our warriors, and they are warriors. I tell it all the time. I saw it again this morning. He's young, in many cases older, but they're walking into the hospital.
Young, but many
and
cases
they're
older.
putting on I mean, as their doors open, they're going into this place, and it's not exactly too safe. And they're going in there, and they're putting the outfits on, and they're putting their masks on, and it's incredible. It's like no different than you watch the war movies, or you watch the old clips of war running up hills. To me, it's the same thing. Men and women, young and old, but a lot of young people.
A lot of
just
young.
going
Yeah,
in.
all
They're
young,
not
no, but a lot of
thinking,
young.
"Oh, gee,
But
this
there are
is
some old,
dangerous,"
a lot of
and
old,
saying,
but mostly young.
I don't want to go in.
A lot of young.
They're
Oh.
warriors. They're running through those doors. It's the most incredible thing.
This press conference could be
beautiful.
5
It's
minutes
incredible,
long
beautiful
if
thing.
he would just
Resources
take away all
from
of
the national
the
stockpile
necessity of him to speak.
need to reach these warriors in the hospitals immediately, and we're making sure they do.
Making sure that
And again, the states have that responsibility, but we're working with the states, and we're getting the states a lot of things that they can distribute, or when they tell us, we bring it directly to the hospital from the federal stockpile or from the planes that land, without even going to the stockpile. If any state's having difficulty distributing supplies, we urge you to use the National Guard to assist in the delivery. And I have to say, you have done a fantastic job. Deborah, you know that you've done great. Tony, you know that you've done great, but what a job you've done, and I appreciate it. I really do. Your whole group has been incredible. That's a lot of stars you have, I'll tell you that. He's supposed to do a great job when you have 4 stars, right? But the military has been incredible, and I thank them for all of us.
except for the
Conversely, if
captain.
a state believes that it has
'Cause we had to fire
surplus
him.
equipment or supplies, very important, because we actually have gotten so much to some of the states that they're able to now. They've done a fantastic job, and they've kept that line low. And we have some states that have surplus equipment and supplies, and they're working with us to rapidly redeploy those
snake oil
supplies
salesman
to areas
kisses all the time.
of greatest need. We thought that might happen. If it worked out well, that's what was going to happen, and it's happening. And I want to thank Governor Gavin Newsom, who's doing a tremendous job, who's announced California will send 500 ventilators to be distributed to other locations. I think some are going to Arizona, some are going to Washington, D.C. We think they're going to Delaware. We're working it out, but 500 excess ventilators
The
from the
federal
state of
government should be
California.
coordinating all
and,
this, though.
We're
They
going to
should be
get them
coordinating the needs.
taken care of
Without
where
having
they
to
have to
worry
go.
about
Those decisions are being made
States
right now.
gifting them. This is what the job
The
of the federal
members of the White
government
House
is.
Task Force and I are
And
in
then you
close
want to
touch
berate
with
states for not
mayors
being
and
prepared.
governors,
How are they supposed to be
hospital
prepared
administrators
when you
across our
don't
country. And
give
we're
them the
told
information that they
the
need to prepare, and then you
present
take
time, at the
items from
present
them when they
time,
try
most
to
of the critical
prepare.
needs are being more than met. States have to continue sharing detailed information in the amount and utilization rates of medical supplies so we know what to resupply them, or they can get it directly. That includes ventilators. They can get it directly.
Apparently, there's
Ideally,
a
if
bunch
they
of
can get
states
it
are now
directly,
getting
but if
together
they
to
can't, if
just
they're
buy
unable to
everything
do
in
it, we
bulk
have
and share it because they don't want to be
tremendous
competing
amounts of
against each other
supplies, and we're building it up
be
very
paying
fast.
higher prices. Why
This
they
is
have to
before
pay
the
higher
big
prices?
surge.
Why we haven't come in and
This
said, look,
information is
these need to be made
fundamental
for us
to our
now.
ability to deliver the material when
That's beyond
when
me,
and
but
where
that's
it's
the
most
ineptitude of this
needed.
administration.
Now, Mike, in his conversation today,
Mike,
I think got some information as to a couple of locations where we're going to be delivering large numbers of ventilators and large numbers of medical supplies, and we'll take care of that. But some of the states are very happy. Even Governor Pritzker from Illinois is happy. Of course, he may not be happy when he talks to the press, but he's happy. He's a very happy man. We're increasingly hopeful that
such
the
a
aggressive
child.
mitigation strategy
Such
we
a
put into
child. We've
place
put a
will
child in
ultimately
charge of the
allow our
federal
hospital
government.
system to
A
successfully
child.
manage the
Child.
major influx of cases that we have right now. Again, I say that we're finding, because of the incredible job done by the American people, in conjunction with everybody, governors, the military, federal government, state government, local government. I've had a lot of conversations with New York City and Mayor de Blasio. I've gotten to know him. I didn't know him. Gotten to know him. And a lot of people are working hard. Everybody's working hard. A lot of people are doing a great job. I'll tell you that. A lot of people are doing a great job. But the goal is that all Americans have been
But no one's doing a
sacrificing
better
to
job than
achieve
me.
these last few weeks, things that a lot of people thought were not possible to achieve. And I think we've more than achieved, but we have to go through. Again, we're going to have a rough week. We're going to have maybe a little more than a week. But there's tremendous light at the end of that tunnel. I said it last time, said it last night. There's tremendous light at the end of the tunnel. There's so many things happening with therapeutics, with vaccines, with things that we really want. Deborah, Tony, they're all working so hard on this, but those therapeutics, I mean, look, the vaccines are going to be always a little bit later because of that testing period, but the therapeutics, getting the kind of things that I heard about today, talking to these brilliant companies and brilliant people on the phone was fantastic. It was such an incredible conversation.
It's an incredible conversation.
And
Such an incredible
I
conversation.
also spoke just a few minutes ago with former Vice President Biden, who called, and we had a really wonderful, warm conversation. It was a very nice conversation. We talked about pretty much this. This is what we talked about. This is what everyone's talking about. This is what they want to talk about. And he gave me his point of view, and I fully understood that. And we just had a very friendly conversation. Lasted probably 15 minutes. And it was really good. It was really good. Really nice. I think it was very much so. I appreciate his calling. As we
Okay, it was
continue
nice.
our efforts to develop treatments and cures this afternoon, I spoke with leaders
There goes
of
hydroxychloroquine.
the American pharmaceutical companies, and just to give you their names, Amgen, Genentech, Gilead, Regeneron. These are four of the greatest in the world for doing exactly what they're doing. And currently 10 different therapeutic agents are in active trials, and some are looking incredibly successful, but we have to go through a process. And it's going to be a fairly quick process, I will tell you, based on what the FDA told me. And another 15 are in plans for clinical trials. So they're advancing rapidly. And today, a second company announced that the FDA has authorized its vaccine candidate to begin clinical trials. So you have Johnson & Johnson is already there. I believe they're the one that's first. And now we have a second company that just announced, and was just approved. So we have two companies at that level for the vaccine itself. We've now performed 100, well, if you think of this, 1.79 million tests. That's 1,790,000 tests nationwide. And I think we're going to put up a screen here someplace. Good. They're on cue. They're just on cue. And here it is. This is the process starting on 5 March and ending right there, right about now, right? That's about it. So, and it's going up at a rapid rate. Nobody has done more testing. And one of the
Nobody's done
reasons
more.
why they say, and I think I can say this, Deborah, very
What about
strongly.
per capita?
One of the reasons that we
Per
have more cases is
capita.
we've done more testing. If I went to some of these countries that have, in my opinion, far more people than we do that had the problem, and if we did the kind of
Per
testing
capita.
proportionally that
We
we're
want
doing,
to
they'd have
know
many
per
more
capita.
cases than us.
You don't
But we have more
it more
cases
per
because we do
capita.
much more testing. So when you do the testing, you have cases. Otherwise, you wouldn't know about the cases. People sit home, you don't know about it. But we have now done 1,790,000 tests nationwide. That's more than any other country in the world. Hence, we have more cases. And that number is growing by nearly 125,000 people per day.
Per
Think of that
day.
one. So it's growing by 125,000
Well, we need to
people
have
per day.
more people. You're
I
going to
told
have
you
more
about
tests
South
if you're going to
Korea.
get
This
it.
is
And you
a,
talk about this, but that's why I keep saying per capita.
Vastly faster, and we also have, they say, the most accurate of tests. CVS is launching, and they've been great. 2 new drive-through testing sites in Atlanta, Georgia, and Providence, Rhode Island. And each location will be able to test up to 1,000 patients per day using the ultra-fast 5-minute test developed by Abbott Labs. Now they're down to 5 minutes. They call it the ultra-fast. It's very accurate. Abbott Labs, I want to thank
So
them.
does
They've
anyone
been
believe
fantastic.
Donald Trump when he
We're
says
also
anything?
speeding
I mean,
urgent
if
economic
Abbott was
relief
telling
to
me
the
the
American
accuracy
worker
of the
and
test, I'd
families
believe
and
them. But I
the
don't know what.
employers.
I don't know if I believe
As of today,
Herr Trump.
tens of thousands of small businesses have
Herr
applied for more than
Gruppenführer.
$40 billion in relief under the Paycheck Protection Program. You've all been reading about it, and it's really, I mean, it's only been going for a couple of days. It's really been performing well. A couple of little glitches, minor glitches that have already been taken care of, what they say. These funds will result in nearly 2 million jobs being preserved, so we're taking care of our workers, small businesses and our workers. Nearly 3,000 lenders have already made loans under the program, and we're signing up additional lenders very quickly, rapidly.
It's ridiculous that you can't really
Community
find
banks
these
have been
information
very
on their
responsive, and larger banks are also
on their
stepping up.
sites.
If this if
And
we
then some
run out of
banks were like, you
funds,
can
by
only
the
do
way,
it if
we're
you're
already
a
preparing
business
because it's going
customer
so
of ours.
fast for
And
the small
I'm an
businesses
independent
and their
contractor.
employees.
I
We'll
qualify
ask
under the
Congress
terms
to
of it.
refill it immediately.
But
the banks have been
I don't
great.
have a
The big
business bank
banks,
because I just use my
the,
personal account.
Bank of
for-
America
then they pay
was
me.
right up there at the beginning. J.P. Morgan Chase has been great. After the first day, they really came through, and a lot of the big banks, but the community banks have been fantastic. As we announced last week, we are providing $100 billion in direct support for our hospitals. And the first tranche, $30 billion, will be distributed this week. So I want to say one other thing. Our farmers, we love our farmers. And as you know, as of April 1st, the China trade deal, $250 billion.
That's a. I think I
They
learned a new
purchased
word from President Trump
$250
today.
billion from us, if not more.
Tranche. First in a
And,
series of payments. Now,
Of
that's
that,
probably
approximately
paperwork,
50
so
billion is
therefore,
expected to
somebody
be
probably wrote it
with
for
our
him.
farmers.
I don't know if he knew that
So
word or
it
not.
kicked in as of April
Tranche.
1st.
I thought he was
and
making
we'll
up
see
a
how
word
it
there.
goes.
There
It
you
seems
go.
like they're buying. So
One
we'll
of a
let you
series
know,
of payments to be
how
paid
that's
out over a
going, but
specified
they're
period.
buying anywhere
Tranche.
from $40 to $50 billion worth of our agricultural product. That should have a huge impact on our
Huge
farmers, a tremendous impact on our
Tremendous.
farmers, but we're watching it very closely. To fight the medical war, we've mobilized the unbeatable, and it is unbeatable strength of American determination, ingenuity, and compassion. I got to see that when I spoke to the great science, because I call them science companies more than drug companies. They're
Great science
scientists.
companies. There's great.
We've seen businesses,
sciencey
charities, and private citizens making
and
generous
great.
donations. So many people are making donations. We've seen states and cities supporting and helping each other and caring for our citizens. And we've seen Americans of all backgrounds and beliefs uniting together to answer the challenge and rise to the moment, and that's what they're doing. Above all, we've been awed and inspired by the exceptional courage of the doctors, nurses, EMTs, and healthcare workers who are the soldiers of this war. No words can ever express the complete measure of our gratitude for these intrepid heroes. One Cleveland patient credited his medical team for not only saving his life through their skill, but forever changing his life through their example of selfless devotion. Couldn't believe it, so generous he was with his statements. And he talked about their bravery in an area that was in such trouble, an area of that hospital where people were dying, and he talked about their bravery. Another survivor in Houston said simply, "I will consider them my angels forever. I will consider them," think of that, "my angels forever." As our nation endures the depths of loss and grief, we are also witness to the summit of American virtue, character, and courage. With the love and dedication of every American patriot, we will win this battle, we will defeat this enemy, and we will rise from this present crisis with new strength, unity, and resolve. And that's what's happening. Tremendous stories are coming out of this horrible moment, very dark moment for the world. 182. I was saying 151 for a while, and then it got up to 160, and it's 182, as I announced yesterday. 182 countries are being attacked by this virus. So
by this enemy,
I just
the
want to thank
invisible
everybody.
enemy.
I want to thank the American citizens for doing a great job. Stay inside, and let's win this, and let's get our country open as soon as we can. I think it's going to be sooner than people think. Things are going really well. Again, light at the end of the tunnel. And with that, I'll take a few questions.
People are
and
gonna
then Mike
die.
is going to take over and talk with the Admiral and with the professionals, and we appreciate you being here. Yes, please.
Mr. President, you mentioned that you were asking U.S. drug companies to provide treatment to the British Prime Minister. What sort of treatment is that? Is that something that is available
Well,
to
it's
the
a
American
very,
public?
it's a very complex treatment of things that they've just recently developed,
What's
and
that?
that they have
The very complex
a lot of
things,
experience with, having to do
things
with
that have been
something else,
developed.
but recent
What does
for
that
this.
mean?
And they'll be, they've already concurred, they've already had meetings with the doctors, and we'll see whether or not they want to go that route. But when you're in intensive care, it's a big deal. So they're there, and they're ready.
You didn't answer
We
the
have
question
four-
of the
we have-
reporter.
I spoke with four.
Is it something that's available to
four
people
would be-
here or not?
And you know, the people within
The
those,
people.
you probably, you'd know the companies, I told you the companies, but the people are the greatest in the world. So they're at the hospital, and we'll see. And they have everything with them should it be needed. Hopefully it won't have to be needed, but should it be needed. I found Boris to be a fantastic person, just like a fantastic, warm, strong, smart guy. He loves his
Excellent.
country.
Tremendous
I mean, he fought
person.
like-
He's a tremendous
like hell
person,
for his country.
but not bigger than me.
And intensive care is big stuff, really big stuff.
Yesterday you were asked about this as well, but now that he's been moved to intensive care, does that give you and the Vice President any pause or additional concerns, steps that you're taking to preserve
Well,
the continuity of government here?
No, I don't think so. Mike had his test a couple of days ago. I had my test a couple of days
I
ago.
took a DNA test, found out
And we're here.
I'm 100% that
Here you
asshole.
are. So no, I don't think so. But I think we'll probably,
And my neck looks like a vagina.
just because of questions like that, I think we'll probably have maybe quite a few tests. It's not the worst idea. You know, the system of testing now is so quick and so easy. So I could see, and you were tested again today? You sure you're okay?
I'm okay.
Good, then I'm staying here. Yeah.
Despite the nearly 1.8 million tests that you say the United States has done, the Inspector General for the Department of Health and Human Services released a report today, a survey of more than 300 hospitals across the country, and the number one complaint from those hospitals were severe shortages of testing supplies and
Well,
a
it's
really
just wrong.
long wait time. I mean,
It's
a
just
week
wrong.
or longer.
And did I hear the word Inspector General? Really? It's wrong. And they'll talk to you about it. It's wrong.
But this is your own government.
Well, where did he come from, the Inspector General? What's his name?
It came from the Inspector
No,
General
what's his name?
report.
What's
I
his
don't
name?
know his name
Well,
off the top
find
of
me
my
his name,
head.
let me know, okay? If
But-
you
Find
find me
his
his
name.
name, I'd appreciate it.
But sir,
I don't like inspectors
these
general.
are
All I can
hospitals
tell
that
you
do
is
not
this. we
Sir,
put up on the
these-
board. You're gonna ask the Admiral. But
These
we are
hospitals
doing,
who say that they're waiting a week or longer
Fine.
to get
Just
their
speak to
test
the Admiral.
results. Why
but
is
we've
it
done
still
more
taking so
testing
long?
and had more results than any country.
We have more
Anyone
testing. It
that
doesn't
we're
matter if
doing
it's per
incredible
capita. It
job.
doesn't matter.
Now they're all calling us. They want our testing. What are we doing? How do you do the 5-minute test? How do you do the 15-minute test? So give me the name of the Inspector General. Could politics be entered into that? Go ahead,
This
please.
is our.
Politics are
ahead.
when you do it.
Sir, are you worried about retaliation to your decision to ban export of medical goods, like Indian Prime Minister Modi's decision to not export hydroxychloroquine to the United States and other countries?
I don't like that decision. If that's, I didn't hear that that was his decision. I know that he stopped it for other countries. I spoke to him yesterday. We had a very good talk, and we'll see
Tremendous
whether or not
talk.
that's his. I would be surprised if he would, because India does very well with the United States. For many years, they've been taking advantage of the United
This
States on trade.
country's
So I would be
president did
surprised if
this,
that was
but
his decision.
Trump
He'd
doesn't
have to
believe
tell
it.
me that. I spoke to him Sunday morning, called him, and I said, we'd appreciate your allowing our supply to come out. If he doesn't allow it to come out, that would be okay, but of course, there may be retaliation. Why wouldn't there be? Yeah, please.
Thank you, Mr.
They're
President.
retaliating
the
you for what
Paycheck
you're
Protection
doing.
Program has gotten off to a confusing start for small
I don't think
businesses
so. I think it's
because
done very well.
Wells Fargo has stopped taking applications. Bank of America
Not
initially
anymore, they haven't.
prioritized taking applications from clients that were already
Bank of
borrowers.
America has
So-
been the leader, taking tremendous numbers of applications. And
Tremendous,
of course,
huge,
they may
big
have been-
league.
they wanted to have a slightly different application. They wanted to have a little different information. But Bank of America has been a leader. They're number one in terms of applications.
Processed
I
and
wish
paid
you'd ask
out.
the question differently. Why don't you say it's gotten off to a tremendous start, but there are some little
Because it
glitches,
hasn't.
which by the way have been worked out. It would be so much nicer if you do that.
Why don't you kiss my ass? Is what he's saying. Why don't you kiss my
Incapable of asking a
ass?
question
Sir, what
in a
oversight
positive
measures
way.
is the federal government
It's
putting
already
in
done.
place
It's already
to
done.
ensure that there is
It's taken the
fairness?
measures. It's taken the measures.
What measures
And
are they?
We may even do a
You
different
don't even want to answer
system.
the
Not
question.
with this, we're going to have to probably add more money to this to save and to keep our small businesses going and to keep the employees of those small businesses working. But it's such a positive event, and you ask it in such a negative way. It just, I wish we had a
I
fair
wish people
media
would
in
just
this
kiss my
country. I
ass.
really
It's not a
don't.
matter of fair media,
Speaking
you
of
dumb.
unfair, go ahead.
Mr. President, the acting Secretary of the Navy told the crew of the USS Roosevelt that Captain Crozier was either, quote, too naive or too stupid to be in command. Is it appropriate for the Chief Officer of the Navy to be speaking this way about this captain? Is this
Well, I
the
haven't
right way-
heard it exactly. I haven't heard. I heard they had a statement that was made. If that were the statement, it's a strong statement. Look,
It's a strong statement.
the letters shouldn't have been sent, and certainly they shouldn't have been leaked. This is a military
Who sent? Who
operation.
leaked the error
I
letter?
must tell you,
We
I've
don't
heard
know.
very good things about
I don't know. They think
the
the
gentleman,
captain sent
both
it.
gentlemen, by the way. I will say this about both gentlemen, and I may look into it only from the standpoint that something should be resolved, because I'm hearing good things about both people.
Look into, sir?
I may just get involved, if it's okay with you.
What do you mean?
Yeah, because you know what? You have two good people, and they're arguing. And I'm good, believe it or not, at settling arguments. I'm good at settling these arguments. So I may look into it in great detail,
I'm a
I'll be
moderator.
able to figure
I'm
it
a
out
great
very
moderator,
fast.
the best
But
moderator
that was
there's
a
ever
statement.
been.
It's a rough statement, but look,
Reinstate him
look,
if you
look.
decide it was.
Letters should not have been sent to many people,
People.
unclassified. That was a mistake.
Who sent
It's
it,
a
though?
mistake that shouldn't have been made.
I haven't
because
seen any evidence
it's
reporting that he said
unfair
that he
to the
sent it.
families of the people on the ship because they get nervous, and it shows weakness. And there's nothing weak about us now, not anymore. We have the strongest military we've ever had, and we're not going to be showing.
So you're saying the
weakness to
military was
anybody
weak before you
because we
became
have-
president?
that ship
That's what
is
you're saying?
incredible. Nuclear-powered aircraft carrier.
He doesn't love the
And
military.
we
He
don't
just
wanna
loves
be doing
himself.
writing
The
letters. We
military
don't
was
wanna have
strong
letter-writing
during the Obama
campaigns where
administration, during the Bush
the fake
administration,
news
during the
finds a
Clinton
letter that
administration,
gets
during the
leaked. We
Bush
don't want that.
administration.
So the letter, excuse me, so the letter shouldn't have been sent. With all of that said, his career prior to that was very good. So I'm going to get involved and see exactly what's going on there, because I don't want to destroy somebody for having a bad day. Okay, does that make sense? Okay. Yeah.
Mr. President, Vice
Probably
President
wanna see it.
Biden's spokesperson said that he made some suggestions to you about actions that you could be taking to
He
deal
did.
with the
We
pandemic.
did. We had a very good talk. We agreed that we weren't going to talk about what we said, but we had a very, very good talk. It was a warm talk. I enjoyed it. I hope he enjoyed it too. And it was short. It was 15
I
minutes.
enjoyed it. It was warm. It was the best talk ever.
Suggestions, anything that you're going to do?
Well, he
All my
had
talks are
suggestions.
perfect. It was a
doesn't mean
perfect
that I
phone call to
agreed with
Biden.
Suggestions, but certainly he had suggestions. And I also told him some of the things we're doing. But the conversation was a friendly, very friendly conversation. Yeah, please.
Thanks a lot, Mr. President. You've mentioned, other members of your task force have mentioned, over the course of the next 2 weeks, it's going to be a very difficult time for our country in terms of fatalities. And
It will be a difficult week and a half.
and there are a number of governors who are close allies of yours, Mr. President, who have refrained thus far to have these stay-at-home orders. And Dr. Fauci, who of course is on your task force, has said that
True.
the states that don't have stay-at-home orders are putting themselves at risk and the country at
Well,
risk.
if Dr. Fauci said that, I would be inclined to call them up. You know, we do have a constitutional problem in doing that. You understand that? I mean, there's a
You
double.
can tell them
there's a
to
double-edged
shut
sword.
down.
You understand? I
Tell
can
people
do
stay
it,
at
but it is
home.
a constitutional. You can say federalist. You can say there's lots of different reasons where I would rather have the governors do it, make their own
Well,
determination.
you'd rather have them do it, but they
they're smaller-
want
I
somewhere
know
to
in
hang
cases,
their
but
hat.
sort of they're
Say
smaller
the president.
cases,
If you
but
told
I'm not
those
sure
governors in
100%
red
that Dr.
states that
Fauci
you
said
want
it,
them
but
to
you
have
can
a
ask
stay-at-home
them.
order, those governors would absolutely come along and do
I had
it.
good conversations with the governor of Nebraska and the governor of Iowa here, and it's interesting that functionally, even though they have not given a strict stay-at-home, what they are doing is really functionally equivalent to that. And we had a really good conversation with both of the governors, when I had mentioned that, I think there was a public response that they weren't really doing anything at all, and they really are doing a very good job, both of them. Those are the only two that I spoke to, but it was a really good conversation, and I want to make sure people understand that just because they don't have a very strict stay-at-home order, they have in place a lot of things that are totally compatible with what everyone else is doing.
If I could ask a question, Dr. Fauci, before you.
Go ahead.
About getting back to normal, you said you wanted to get back to normal as soon as possible. Will we truly get back to normal in this country before there's an actual vaccine that's available to everybody? How do you start lifting the restrictions?
Yeah, well, John, if back to normal means acting like there never was a coronavirus problem, I don't think that's going to happen until we do have a situation where you can completely protect the population. But when we say getting back to normal, we mean something very different from what we're going through right now. Because right now we are in a very intense mitigation. When we get back to normal, we will go back gradually to the point where we can function as a society. But you're absolutely right. I mean, if you want to get to pre-coronavirus, that might not ever happen in the sense of the fact that the threat is there. But I believe with the therapies that will be coming online and with the fact that I feel confident that over a period of time we will get a good vaccine, that we will never have to get back to where we are right back now. So if that means getting back to normal, then we'll get back to normal.
I think that with the therapies, and I think that with the vaccines, which I have total confidence are coming, and I'm dealing with the companies. I'm talking to Johnson & Johnson. I'm talking to all of them.
More Johnsons than any other
When
company.
you add the tremendous stimulus that we're giving, like for instance, deductibility for restaurant expenses for restaurants and entertainment, the money that we're talking about for small businesses and employees to keep everybody working, and other things that we're frankly working on right now, which are going to be great for our people. I think when you add that to it, I think we could get more than back to normal from an economic standpoint.
More
Actually
than
be
back
better.
to normal. What does that
More
mean?
than back to normal. But I would agree that we'd love to see a vaccine, but immediately would love to see a therapeutic. And I think we're getting very close.
Do you think you'll be able to lift restrictions on April 30th? Right now,
I
you've
don't want
extended
to
them.
comment on that, but I can tell you that
'Cause we're not going
we
to.
certainly want to try. We certainly want to see what's going on.
We're not going to
doing
lift
very well.
restrictions
You look
before
at
April
those-
30th.
You look at most places where that, you can call it the bump, you can call it the hill, you can call it the mountain, you can call it whatever you want to do it. It's very flat. You take a look.
I
and
like
that
to
was
refer
done
to it
through
as the
mitigation.
boob.
That was done through a lot of good work.
Just like I'm a boob.
And that far exceeded our expectations before. I mean, people can't even believe how low some of those bumps are, some of those hills are. They're very surprised. Now, you have a couple of tough ones. New Jersey's been very tough, and New York has been very tough. They're crowded in, it's tight, it's tougher. But we far exceeding, California far exceeds, Washington State far exceeds. You look at so many of these states, how well they're doing. The 8 states, by the way, and I haven't spoken to the governors, but Tony's so right. They may not have it from the standpoint that they're saying it, but those people are practicing it, and they're doing a fantastic job. Take a look at where they are
ever.
in terms of the levels, but take a look where they are. So, but if I thought it was something that, and I've looked at him, and I've looked at him very carefully, looked at him today, looked at him yesterday, from a constitutional standpoint, I'd love not to get involved with that, and not from a legal standpoint, just from a moral.
Not from a legal standpoint, but from a constitutional standpoint.
Because legally, I
What?
can. But morally, I believe in our Constitution much more so than most people.
Yeah.
And I'd love to be able to let the governors do what they have to do.
No.
Those states are doing a fantastic job, all 8 of them. They're doing a fantastic job. So we'll see what happens. As per your question, you fully understand what I'm saying, so thank you. Yes, please.
Hi, I have 2 questions if I may, one from somebody outside the room. But first, can I ask, do you think Boris Johnson, when he talked about shaking hands with hospital patients, did he downplay the threat of this virus too much? And do you know exactly what his current
Well, I think
position is?
Boris was looking at it differently. He was looking at it earlier. He was looking at it like ride it out. There were many people thinking about riding it out, meaning, whatever it is. But then you see what starts to happen, and the numbers become monumental,
Huge.
and they decide not to do that. We actually moved early. We moved early because of what we did with respect to the ban on China coming in, and then
Except it
Europe
wasn't
coming
enough,
in.
and the
That
other
was an
things
early
weren't
ban,
enough,
too.
and
then
your hiding
UK.
information wasn't enough, and you're wanting a
So,
miracle wasn't enough.
No, he waited a little while, and he.
You can't rest
felt that, but
everything
he
on your
got-
China decision.
He made a decision very quickly thereafter to do what they did, and they've gone to a very strict lockdown, but they're suffering greatly as a nation right now. They're going through a lot. They're a nation that's having a difficult time, but I've gotten to know him. He's just such an incredible guy. It was just so shocking to see that, because you know what that means. Intensive care is a big deal with regard to what we're talking about. That's a very big deal, very scary deal. Yeah, please, Jeff.
Just somebody who can't be in the room due to social distancing has asked me to ask a question. It's Thomas Howell of the Washington Times. How many health workers in the US have become infected with COVID-19? And if the answer is not known, will the CDC be publishing that data
Yeah, I
soon?
could get you that information. I think they'd probably be willing to give that, right? Yeah, we could get you that information. Jeff, please.
Mr. President, OPEC is meeting on Thursday, and
Yeah.
they have said that they are willing to make a cut in production if the U.S. chips in as well, which suggests that they want you to ask U.S. producers to do an
Well, you're the first
orchestrated
one that's
cut.
told me that. I don't know. We'll have to make that decision. And maybe we will, maybe we won't, but we'll have to make that decision.
But you would
I think the cuts are automatic. If you're a believer in markets, I can guarantee
If
you
you
there's
believe
a
in
cut
markets,
from
you don't
pre
artificially
this condition.
reduce
look,
supply.
This happened because of the virus. The
Market
virus
forces.
knocked out 40%. It went down in 1 hour. I mean, literally, when places closed up, you're talking about a 40%
You don't believe in
cut.
capitalism if you.
No,
if
I
you
think it's happening automatically, but
actively
nobody's
support
asked me
the
that
idea
question
that
yet, so we'll
you
see what
should
happens.
You would
I'll let you know
artificially
Thursday
increase
evening.
your
Right, that's the deal. But
Okay.
you would
Supply.
consider asking U.S. companies to
Well, I think
reduce.
it's automatic, because they're already cutting.
You
I
have
mean,
your
if you look,
supply of
they're
your
cutting
good,
back.
then you have the
Because
demand.
It's market, it's
You can't
demand, it's supply and
artificially, if
demand.
you artificially
They're already
manipulate the
cutting back,
supply,
and they're cutting
you're
back
not
very
having a
seriously.
free
But
market.
if OPEC is asking for a signal from
Well,
the
nobody's
U.S.
asked me
None
that,
of
so
these people
if they
who
ask me, I'll
claim
make a
to support
decision.
markets actually like free
Okay,
markets.
but again, it's happening anyway. Yes, please.
In light of all the discussion about Prime Minister Johnson and his health, can you update us on the status of the second half of your physical that you were going to have this year?
Yeah, so I had a physical.
It was a
The
great
first
physical.
half
It was
very
perfect.
successful. I did it
Successful.
on a day when I was in the
Successful
White House,
physical.
and we were able to
I
do
did
that
the
as
physical.
doctor
I was
reported.
successful.
And I have some, the second half of the physical different. Probably is done at Walter Reed, and I'll do that at the appropriate time, but I feel very good, and according to the doctor, very good shape.
Can I just
He's
ask
round
again
as a
on
shape.
The idea of a national stay-at-home recommendation. What is giving you so much pause about
I
making a
told you,
recommendation?
I told you. He understood very well.
I prefer the
Appreciate your
governors.
understanding.
It's not an
It's
order,
called
just
the
a
Constitution of the
recommendation.
United States, and I'd rather have, if possible, for the governors to make
Constitution
the
does not
decision.
prohibit you
If a
from
decision
recommending that
was
everybody
very
stay their asses
necessary,
at home.
and they have done a good job, and Tony said it better than anybody. They are doing what we're asking them to do without having to put the seal on it. But I will
Be a
say,
leader.
if I thought it was
Lead.
necessary, I'll do it in a heartbeat.
I know it's against your
Agree
better
with the
nature,
Georgia
or against your
governor.
nature, because you don't have a better nature. Lead.
Opening what?
The beaches?
I haven't seen, I'm gonna have to see to what extent. I'm gonna have to see how many people you're talking about. Are they
How many
crowded?
people are on
they
these
packed?
beaches?
Are they not packed? We'll have to take a look at it. Right now, it's very early for beaches in Georgia. So it's right now, very early, so I'll take a look at it. He's done a very good job.
Donald
He's the
Trump, an
governor.
expert
He
on
knows what he's
beaches in
doing.
Georgia?
We'll have to take a look. It really does depend on, how crowded it may be. But I will talk to him and I will ask him that question. I would ask him, yeah, please.
Mr. President, you said last week that you were considering travel restrictions around hotspots. Is that something that's still on the table, and at what point?
We're looking at it, and the airlines have been cutting their routes. You saw that yesterday. They announced big cuts in routes. We need some flights for emergency use.
We should be
for,
flying at all,
military
except
people.
for
We need some flights for medical
necessary
people.
purposes.
And there are very few flights,
There
as
are
you
people
know,
who
and the
need to
flights that are going
fly.
out are.
They should
I think
be able
they
to
said they're
fly.
3 to 4%.
Nobody else
full.
should fly.
You have 3% of the plane that's occupied.
Ground them.
So it's they're very, very generally very, very empty planes, but it's good to have. It's a tiny amount of flights relative to the overall, and we need them also for medical workers. Otherwise, we're going to have to do a whole big thing with our own planes. So.
We need
they're
it,
done
otherwise
for
we
a
have to do
reason.
something
There's
with our own
also
planes.
testing done when people
You
get
can
onto
fly
those
people when you
planes
need to
and
fly
also when
them.
people get
You
off
can
the
say,
planes.
okay, we need to get this flight,
Follow
let's
up
do
on-
it.
On this question
Without-
of the HHS Inspector General, and by the way, her
stupid.
name was Christy Grimm, and it wasn't so much her opinion, but they interviewed 323 different hospitals.
Well, it still could be her opinion. When was she appointed? When was she appointed?
I'm not sure when she was
Would you do me a
appointed.
favor? Let me know.
I'll check.
No,
on
no,
that.
let me
But-
know now. I have to know now, John. Let me know
I
now.
have to know
Because
now.
we are doing an incredible job in testing. We are doing a better job than anybody in the world right now in testing. There's nobody close. And other nations admit this. Other nations have admitted it very strongly. Other nations are calling us, wanting to know about our testing. Let me know when she was appointed, would you?
Specifically,
Go ahead,
what she
please.
was saying was that there had been a delay in the.
Okay, thank you very much. Go ahead.
Thank you, Mr. President. Only last week, there were multiple flights coming from China full of medical supplies.
Yes.
Companies like Huawei and Alibaba has been donating to
Right.
the United States
People I know very well.
1.5 million N95 masks and also a lot of medical gloves and much more medical supplies.
Sounds like a statement more than a question.
And Chinese Ambassador Cui Tiankai last night wrote an op-ed on New York Times calling to cooperation with the United States. So are you personally working directly with China?
We just
on
signed a trade deal.
So fighting with the
It's the
virus?
biggest deal probably ever made.
The trade deal has nothing
And I
to do
hope they're
with,
gonna
with,
honor
the, with
that
the
trade
question
deal.
that she.
If they don't honor the trade deal, then I'll tell you a different answer. But
She asked
I
a
think
question
they
about
will.
working together
They're
on the
gonna spend
virus. You
billions of
don't
dollars for agriculture.
not
They're going to spend billions of dollars for many different things.
about your trade
Whereas
deal.
China
medical
never spent
supplies.
money in our country. We spent money. We had a deficit, a trade deficit with China for years.
Not what
of
we're talking
$500
about.
billion,
Why are you
$400
so
billion.
dumb?
We had the biggest trade deficits in the history of the world with China.
Not
Now
what she
China's
asked you
gonna spend a
about.
lot- Has agreed to spend
Like I want to.
250
I want to
billion,
take them on her and just
many
throw it.
billions of dollars in our country, much of it going to farmers and manufacturers.
How we
So
elected
I'll
this
let you know.
buffoon
I
is
I
just
hope they're going to honor the deal. We'll find
With
out.
China, are you cooperating with
I don't
China?
know. Who are you working for? China? You work for
I'm
China, or are
working
you with a
for Hong
newspaper?
Kong.
Who are you with?
Hong Kong Phoenix TV.
Who owns that? China?
It's
Is it owned by
based in
China?
Hong Kong.
No, is it owned by the state?
No, it's not. It's a private owned company.
Okay,
Who
good.
cares?
Look, I'll let you
Who
know. I'll give you a good answer to
cares?
that in a few months. I wanted to see what they do. Because it's time for them to help
I want to
us.
see what they
It's time
do.
right now
Be
for China
proactive.
to help us. And hopefully they do.
You
And
are a
if they don't,
terrible
that's okay,
person.
too. But we
Terrible
signed a deal.
person.
It was signed with great goodwill and spirit. And it's time that our farmers benefited, our manufacturers benefited.
Terrible.
And we'll see whether or not that deal is honored. And I think it will be, because I know President Xi, who I like and respect, and I think he will honor the deal he made with us. It just went into effect 4 days ago. I will see whether or not. In fact, I called up just a little while ago. I said, how are the farmers doing with respect to China? Are they buying the product as anticipated? And the answer was, yeah, I think so. But it wasn't the most positive, but it was starting.
But farmers have nothing to do with this. She asked you a question about the damn pandemic.
For many, many years,
working together
China
on the
ate our
pandemic,
lunch because we had
not
people
about
in this position that I'm in right
the
now
trade deal.
that allowed China to get away with absolute murder, and it should have never happened. But we are now dealing with China. We'll see what happens. Yeah, please.
Mr. President,
Wait.
I'll tell you
How
when
many
she
do
was
you want?
appointed.
How many do you want to ask?
So I was going to answer your question you asked me. She was appointed in January of this year to her current position
Good.
as the Principal Deputy Inspector
Okay,
General.
we're going to take a look at it. Go ahead.
I know you don't want to talk about.
On the
Don't
issue of
interrupt. He's
on the issue
talking.
of small business loans, sir, you said that businesses have applied for $40 billion in loans, but can you tell us how much of that money has actually gone out to the small businesses?
Thank
I can't tell you, but I know it goes out very quickly once the loan application's approved, and the process is very fast. And you have to understand, these are banks, and that's what they do, but they were swamped. They were actually swamped. Okay, go ahead. Yes.
I know you don't want to talk about the Inspector General report, but testing is still a big issue in this country. When can hospitals
Put the
expect?
slide up again, please.
When can
Just put it.
hospitals expect to
Slide.
receive a quick turnaround of
Are you
these
ready?
test results?
Are you ready? Hospitals can do their own testing also. States can do their own testing. States are supposed to be doing testing. Hospitals are supposed to be doing testing. Do you understand that? We're the federal
But they can't do
government.
the testing
Listen,
if they don't have the
We're
supplies.
the federal government. We're not supposed to stand on street corners doing testing. They
You're
go to
supposed to
doctors,
provide
they
the
go to
supplies for the hospitals to
they
do
go
the
to
testing, you
state.
dumb
The
piece of
state
crap.
is a more localized government. You have 50 of them, and they can go 50 within here. You also have territories, as you know, and they do the testing. And if
You're
you look
supposed
at
to
the
be
chart, if you
organizing
take a look-
this.
Did they put it up? Yeah.
Of course, it paused. All right, well, apparently my stream is over, but holy crap, this president is inept. And he couldn't answer the question from the person from China, would not answer the question she was actually asking. He doesn't understand the whole thing about the testing and how the federal government should be in charge of this whole thing and organizing the testing and making sure that the hospitals have the equipment available to test. But the person wasn't saying that the hospitals aren't doing that. Hospitals are trying to do tests, and they need the equipment to be able to do it. They need the swabs. They need the alcohol swabs. They need the things to be able to get it up in your nose if that's the test that they're doing, or the vials if they're doing a full blood draw, or if they get to the point where they can do a pinprick, they'll need the items where you can do the pinprick. They need the supplies, and the federal government should be using the might and the power of the federal government. The states should be able to get help from the federal government. The federal government should be organizing everything and making sure, okay, we're going to send this here, this here, this here. Not saying these states should have handled these things by themselves. Furthermore, I've heard that these states that have gotten the items, again, I said this before, they've gotten the items and the federal government took them away because they need them other places. So that's the point. The federal government needs to be the one who's in charge of everything. Buy everything and then distribute as needed. But no, this inept president wants to sugarcoat everything to the point where you all get diabetes. And at the end of the day, more people are going to be harmed because he wants to pass the buck instead of saying the buck stops here. Anyway, it's the end of this week's video. I'll have it posted in a few minutes. Be safe. Stay home. Stay 6 feet away from people. And remember to subscribe to this channel. Follow me on Twitter at Liberal Dan Radio on Twitter. Facebook.com/LiberalDan as well. Anyway, stay healthy, be safe.